was very, very nice enough to accept this invitation, albeit at practically 48 hours notice, to speak to us. And we are very grateful to her. Madhuri is currently the Assistant Superintendent Nursing at Saifee Hospital, and she holds a master's degree in Paediatric Nursing and is a postgraduate in Hospital Management and Healthcare. When I spoke to her briefly yesterday, she had already put down what she was planning to speak to us. And I told her that, look, we all are very familiar with walking to a hospital, getting in, getting ourselves registered, then getting treated, and we walk out. But really what goes on behind this, it's extremely important for us to understand and appreciate what happens in the day of a hospital. What makes it tick? It's a 24/7 thankless job for most of them, especially under trying times. And we really do not understand till we hear from people like her as to what really goes into it. I mean, it's very easy to say that, look, you know, the food was cold and I rang, but the nurse didn't come, and the usual things which we complain about. But if we are able to appreciate what's behind the madness, I would say, we have here Madhuri, and I would request Abuzar to introduce her in greater detail and hear from us about what happens behind the scenes in a hospital. Thank you so much, Madhuri.
Thank you, Barjor. It's my pleasure. So we all know that when a dear member of our family or anybody whom we know get admitted to a hospital, you need a good doctor and you need a good hospital. But the most important thing is that you need very good nursing care. And what is fun in nursing care? At times we want to take the patient as soon as possible back home. And then personally, the member of the family takes care. Your mother takes care of the child, or the daughter takes care of the mother or the father. That kind of treatment and taking care of the patient is called nursing care. So it is very important that you need a very good nursing staff to take care of the patients. I'm glad that we have Madhuri GAWAS here today with us, and she's the Assistant Nursing Superintendent of Saifee Hospital. She has done a Master's in Paediatric Nursing Speciality post, and sorry. Am I audible?
Yes.
Yes.
Sorry, am I audible?
Yes, Abuzar,
Yes, sir.
Yes,
Yes, sir.
Yes, Abuzar.
And she's got a Master's in Paediatric Nursing Care, Healthcare Management, and the Lean Six Sigma Green Belt. Her area of interest is critical care nursing. And in these times of COVID and post-COVID, if I may say so, for the last 2.5 years, it's been a great lot of responsibility on the shoulders of the nursing staff of Saifee Hospital and many other hospitals also. She is the one who also takes a great interest in quality improvement of nursing care, has contributed as a co-author by writing 3 chapters for a medical surgical nursing home. And she has got many books and presented many papers and contributed in preparation of various short-term courses in nursing care development. She is the life member of the Trained Nurses Association of India, of the Nurses Society, and also a senior member of the Infusion Nurses Society. A lot to know from Madhuri on what takes to actually take such good care of the patient so that the patient goes back home healthy, happy, and does not need to come back. Over to you, Madhuri.
Thank you, sir. Thank you for the introduction. Honorable Trustees, Saifee Management, and dignitaries at Rotary Club, I'm really thankful for giving me this opportunity to talk about what happens, behind the scene in the hospital. Now, when we talk about hospital, basically the perception of people is like nurses, doctors are running around. There are like lots of smell of medicine, disinfectant where they use for the cleaning. Then there are cold rooms. There are food, especially food, which is bland and tasteless. So all that perception is there among people, outside. But over a time, it has changed. And if you really could see in the hospital, now they become a patient-centered care hospitals and specially focuses on the patient safety. Like there are various boards, accreditation boards, which specially take care of the patient safety. They have certain their norms and rules and regulations which has to be followed by the hospital. Now when we talk about hospital, the major hardworking professional, as we said, nurses, which are there 24/7, with the patient, all the time with attending them, and they're really always on their toes when we talk about nursing care or patient care or attending patient. Now here I am there to share some scenarios what exactly happened behind the scene. Now when as patient comes to the hospital, either patient come through come to the admission desk, and if it is a plan admission, and then get admitted in the room or goes to ward. Or if it is a critical acute situation of disease, then patient comes to emergency medical department where patient has to be attended immediately. If you see, when you come to the admission desk, you see a big queue and patients are waiting there for their admissions. But we have to have some patience with the desk, because it is a first step when you're getting admitted into the hospital, that the registration. The registration, creating IP number, which will be utilized throughout your stay for every procedure, investigation, treatment, is very important. And you need to provide what is that, safe or whatever accurate information to the help desk, to the admission desk, so that it being for the nurses or the doctors later on to take care of you. So providing information is very important aspect when patient get admitted, at the first time. Then after that, the patient is shifted to ward. If patient comes to EMS, now in the EMS, you always see the nurses, doctors are running around, taking care, because this is a time it is very important, and they have to attend the critical patient, when they come to emergency department. Now in EMS, we have something called triage system. Now triaging is basically sorting out the patient depending on their medical emergency. Now if you see patient with heart attack comes to EMS, it's always important to attend that patient first, rather when the patient waiting vaccination or somebody just comes with some cold and cough. So in that case, the patient relative should understand this criticality and should have some patience, because now many times we have heard about the violence in the EMS, in the emergency department, in the hospital, because they're not been attended on time or some other issue. So this system, they should be well aware about that the triaging happens at first, and based on that the patient is been taken care. After triaging, there is an assessment of the patient happens. Whatever investigations we require to do, the nurses as to their coordination with the department follows. They need to coordinate with diagnostic department. Suppose patient need to be sent for CT scan, or patient need to send for MRI. Now this, when patient goes, or the relative with the patient goes to this diagnostic department, when we talk about MRI, they should be well aware that nobody can enter in the MRI department without permission and without preparation, because MRI machine if you're aware about, it has a strong magnetic field. And if patient with any metal prosthesis, with metal implant enters, that he will get pulled very fast to the machine, and patient may lose a life with that. And it is such a strong magnetic field that it can even pull the jumbo cylinder, through this machine. So we have to be very, very careful, and we have that, checklist to follow. The nurses, doctors, technicians in this departments, they have stringently, they have to follow this checklist before, entering in the MRI department. Even all equipments should be without magnet. So all that care we have to take when such patients enters in the MRI. So all the more we always concentrate on the safety of the patient. Now this is about the diagnostic. When patient comes to the ward, when we talk about admission, like for people, it's admission is just simple term, but it is not. When we in perspective, we see in perspective, nurses or the doctors, when they talk about admission, there are so many small procedures involved to admit one patient. Now, just simple thing like when patient comes to the ward, they need to assess their patient. They need to check the patient thoroughly so that whatever complaints patient has, they can find out, can rectify, can patient can be treated with that. Now, when they come to the ward, the assessment is done. Then there is something called orientation to the patient. Orientation to the patient is it's like a ritual. Like we have to orient, the nurses have to orient the room. It's just a simple like how to operate bed. Nowadays you've seen there are beds which are relatives should be aware how to operate.
Madhuri, you are breaking. If you could kindly repeat. You were breaking. We just lost you for a moment.
Hello. So you can hear me now?
Yes, we can hear you now.
You can hear me now, sir?
Yes, we can.
So I was talking about the admission when it comes to the ward. How careful the nurse, like you see the nurses, always on the, they're running around, like they need to take care of the patient. First thing, that orientation, which is very important, because with that orientation, we can, prevent so many errors which can go, which can happen. Like suppose, patient oriented to the bed, how to operate beds. Then patients are oriented to the call bells, in the room as well, and even in the washroom. If you've seen, there are call bells in the washroom, and any call bell from washroom is considered as an emergency call. So the patient relatives, they should be well aware about this, this technology, which can save their life as well when there is, nurses not around or, doctors are not around. So they have, we have a 16-point checklist. When the patient comes and sits in the room, we have to explain the 16 points to the patient, make them understand that this you need to follow, which is for your safety. And this, we have to make them understand, and then we have to further, carry further. Now, once we orient the patient, we understand the patient has, understood whatever he required to follow, whatever other services we are giving him, that also has to be explained to him. Then it starts with the cannulation, IV cannulation. Now, IV cannulation, when we talk about pricking the patient, I know it is very painful experience for the patient, but when it comes, they always complain, no, only one prick, it should happen with only one prick. But it is okay, the nurses are expert, doctors are expert, but it also depends on the patient's condition. Like patient with dehydration, where his veins are collapsed, it sometimes may not be possible and we have to give more than one prick in that case. So like we need to understand the situation as well, like always not talking about like, doctors doesn't know or the nurse doesn't know how to cannulate. So that is one scenario. Now, when we come to the medication administration, when we give the drugs, when doctors orders the drugs to the, patient, we have to administer the drugs or medicine we can talk about. Usually, like if you see that time of the medicine administration, we write 9 a.m. But you understand the nurses who has another 6 or 10 patients, 9 a.m. when the patient relative comes at the counter and tells, my medicine is not yet given, it is already 9. So half an hour before and half an hour after is always considered a right time to give the medications. So that we need to understand. The relative should understand. So these are certain things which happens at back end, which we have to make a patient and patient relative understand and tell them, like we always tell them that it is for your benefit and no time that we are going to miss your medication. Now coming to the about the you all must have seen the patient with ID bands. Okay, when patient get admitted, we put different type of ID bands. Many times patient ask you why this band, what is the purpose, or they just take it out and keep aside. But this ID band is for their safety. Now this ID band has their own information, the patient's details. Now if we can see there are so many patients and many, there can be two patients with the same name. So for the right patient or correct patient identification, we have different color coded ID bands for the different purpose. Now, if you see that patient with blue color is a normal ID band for every patient. But we have something yellow color ID band, which is for the vulnerable group of patient. Now, who are those vulnerable group? Like basically the patient more aged, geriatric group, more than 65 years old patient, or less than 12 years of old patient, the pediatric group, are vulnerable. Patient with physically challenged, patient with mentally challenged patient, those comes under vulnerable group of patient, and we have to care more for them. Like extra care we require to take. Like suppose geriatric patient, we have something called night rounds, so we have to again and again, we have to remind them, the nurses have to remind them that night time, don't get up alone and go to washroom. You need to take, assistance when you're moving out of bed. So all the certain, instructions, we have a communication scripts, which we have to again and again. So there is lot of things happens just to take care of patient safety and to prevent certain errors which can happen with patient. Now, when patient comes to OT, operation theater, if patient is posted for any surgery or any procedure, it doesn't happen just patient is willed in a OT and then surgeon operates and then patient comes out. It is not like that. There are many certain procedure checklist we require to follow. Like just simple thing, preparation of patient. We need to prepare the patient before wheeling patient to OT. Now this preparation is not only physical, it is a psychological preparation. So the doctors, the nurse need to explain thoroughly to the patient and patient relatives that what exact procedure is going to happen. Something called we have to take consent. There is an informed consent, written consent from the patient and from the relatives is very important, so that they are aware about what surgery they are going to, they are undergoing. Now, once patient is willed inside the OT, the nurses always explain them. We have something called Journey to OT catalog, which has been shown to the patient related, like how it is, what is the environment inside the OT. Like, you're going to be placed in certain area, pre-operative area, then you're going to be there in the operation theater, like who are going to be there with you. So all that explanation has been given to the, patient, so that they are like, comfortable psychologically. Now, when this happens, like in the OT, now again, to considering safety of patient safety, we have something called surgical safety checklist. Now, this surgical safety checklist which is approved by WHO, okay, World Health Organization, and we follow for every procedure, every surgical, surgery. And this has been followed by nurses, the anesthetist, the surgeon who's operating this patient inside the OT. So that we are very much sure about that we are not operating the wrong patient for wrong surgery, or we are not doing any wrong, procedure on that other patient. So it is confirmation that safe procedure, safe surgery by the surgeon. Once the patient from OT will outside in the recovery area, in the recovery room, where we kept the patient there for some time. Now, many times the patient and patient relative ask how long it is going to take. Now, surgery is over. Why my patient is not coming out? Why my patient is still kept inside? Like, what is happening? So it's been explained to them, and unless until patient is, safe to shift from the OT to ward, that call has been taken by the doctors and nurses, and then only patient is wheeled out to the rooms or to the ICU. So this is a big, procedure as such we need to follow, so that we are, very careful that nothing goes wrong with the patient. After OT, when we if you talk about the ICU environment, now we all must be aware ICU, it's like lots of monitors are beeping. There is lots of crowd, people are just around. They're attending emergencies. Patients been intubated. Patients and put on certain equipments, and it's a happening place. So when patient and patient relatives comes to the, they see the ICU environment, they're a bit scared, or that they're not prepared for. So the ICU nurse and doctor has a very important role in this, to explain them and make them understand that what is this, what procedure, what treatment is going on with the patient. And when we talk about ICU, the visitors restriction is very important. We have to explain, the nurses always have to explain their visitors, the relatives. We cannot allow, relatives inside ICU. There are certain visiting times they need to follow and, see their patient, and they need to go back to their place. So this is something very tedious job when we talk about making people understand that you cannot just enter in ICU. Now, why we cannot enter? Because we have to take care of the infection. If we just allow people in and out, we are going to give the infection, we are going to spread the infection, and this is not right. Now, to take care of this infection, if ICU, when you consider it is a lot of infection around people, patients, infectious patients are admitted, but we do take care of, checking this infection periodically, like something we call air sampling, like we do the air sampling. So by this air sampling, we come to know what type, if any organism is growing, or it is clean, or there is no growth. So that care has been taken at the back end when we talk about the infections. Now, next is about, safety protocols. Now we have everything. What we do is basically to make our patient safe, and they should be go happily home. So that is what our focus is. So anytime when patient comes and tells us, a relative comes and tells us that rooms are very cold, but it is better to ask for one extra blanket rather than reducing the temperature. That because we talk about this cold, it is important in point of preventing infection. There, if warm the environment, it is organisms can grow faster. So we have to keep the temperature less to prevent the infection. So that is very important, which we should understand. Now talking about this diet, many times we get many complaints about diet. Like it is tasteless, it's very bland, there is no taste. It's not like home food, but it is because you are there in the hospital, and we have to take care of all this. We cannot just provide diet like that because there are certain restrictions. Like we have we cannot just give oily food, or we cannot just give spicy food like that. We have to follow certain norms because it is for your better, for your health. So that we need to take. They should understand about it. And when we talk about the nurses, you must have seen the nurses, how much they're always running around. And there are certain studies have been done. Actually, studies have been done. They say that nurses walk an average 10 kilometers in a day when they are there on the shift. So it's it's a tedious job. So we need to understand their efforts as well when we talk about when we think about their nursing care. Now this is all about this scene behind what is happening in the hospital, and we have to every point, every steps, we need to be very careful, because ultimately we are focusing on patient safety. And that's why certain organization, as I already said about JCI, NABH, they have come with IPSG, which is called International Patient Safety Goals, and which focuses on nothing but patient safety and only patient safety. So everybody, when we consider hospital, every element of the hospital is equally responsible for taking care of patient and giving that safe environment. So I think I have spoken a lot about what is happening behind the scene in the hospital. And if anything, any point, any question, it is open for the discussion. Thank you so much. Thanks for kind listening.
Madhuri, thank you very much. It was an excellent talk. What really appealed to me is that you hit the nail on the head. I mean, I think your years of experience just came out in this 30 minutes, 35 minutes you spoke. You knew exactly what the patient or the relatives speak. You must have gone through it time and again. But I appreciate the human approach by you and your hospital. I knew that there must be some things like you mentioned about checklists, etc. But the way you mentioned that you explained this, I mean, I think this is a first, which is very, very good. And I think what you brought out was a very normal and humane manner in which you would like to view the patient. I really did not know that there is so much one has to do to get a patient into a room, etc. I just have one basic sort of suggestion, if you can touch upon. You spoke about everything. I particularly liked about the journey to the OT. Because that's the most important part in a patient when he's very worried what's going to happen, etc., etc. So you put him at ease. What typically happens behind the OT scene, in the sense oxygen, gases, equipment maintenance, so that there's no failure during the operation? bands back power. If you can just touch upon that. Okay, when I'm inside, what's going to happen? Because we hear a lot of jokes. Okay, let's have tea till the power comes back. That kind of thing.
Okay. Yes. See, when we OT it's another family, we say it's another group. OT, it's like one family. And when patient goes to OT, there are many equipments. Like we have an anesthesia machine where which have been used. So once patient built in the OT on the OT table, they've been induced. The anesthesia is given by the anesthetist. Okay, before inducing the patient, then anesthetist has to check all his gases, used for the anesthesia, all his equipments, the intubation equipment, so his ventilators, all are in proper place. And there is a checklist for them as well to maintain it. And it's not like only when patient comes in or taken in, but as a regular checking of those equipments happens. Like we have a biomedical department which has been involved again to checks, keep the checks in the OT and wherever the equipment's utilization is there. So that patient has been wheeled inside, patient has been induced, and anesthesia is given by the anesthetist. And then there is a part of surgeon who operates. Now before giving first incision, they need to check as I said, the surgical safety checklist. Okay, so they need to check whether it is the right patient, I'm operating right, right time, and all that checks happens over there. And there is a nurses, we have a scrub nurse, circulatory nurse, we have a technicians, OT technician. So whole crowd is there inside OT who takes care of all their assignments. So after this nurse, scrub nurse, who's first assistance to surgeon, she whatever the trays has been set, trolley has been arranged, so she assists the surgeon for the surgery. Once the surgery has been done, before taking before closure, we say before closure, the surgeon, the scrub nurse has to check all her equipments are in place, including the mops which are used for the surgery. Whether before surgery, she has given around 50 mops. So at the end of the surgery, she should have same number of mops in her hand. So that checks happen so that it's nowhere it is either inside the patient's body or it's been misplaced. So that they have to be very careful of replacing whatever equipments or articles or instruments used for the patient back into the tray. And after everything, confirming that everything is in place, whatever things we have used are in there in the tray, then the surgeon takes the close the incision and close the surgery, and that's how that it's been taken care of. I think I have answered your query or whatever suggestion.
Thank you. Any other members have any questions? Would any members like to ask questions, please?
Maybe a question from my side, Bernhard here.
Yeah.
I think the most important thing in a hospital, apart from hygiene and everything, I mean, that's standard, that's self-understood, is that the patients are feeling very comfortable. So it really depends how friendly the nurses are, how approachable they are, how, approachable the doctors are. And I think there in India, you're doing a fantastic job, I have to say. But I don't know how this comes into your training. How is this part of the training? Because without the empathy, without this feeling of the patient that, he's really well taken care of.
So this is speaking. Hello.
Sorry, maybe I switch off my camera. So without the patient having the feeling that he's really, loved by the people, it's very difficult for her or him, to get better. And therefore, my question is that part of your training? this intercultural, so to speak, apart, of course, from all the medical and technical know-how that, I mean, you anyway have to have, you know?
Yes, sir. Sir, regarding training, we have very, a strategic plan for the training, and we have training calendar. We make a training calendar for whole year. We have a weekly, monthly, yearly calendar for the nurses, so that they on regular basis they've been trained on. Now, this training is always done based on the whatever the feedback. There is a need-based training which happens every week, and especially for special areas like ICU, OT, they have a certain specialized training from certain either from the external or the internal trainers. So even we have certain certificate courses, like we have a critical care nursing course which we run here in the hospital. So our nurses have been trained on this, this aspects. Plus we have specialized training for OT nurses, like OR excellence, which we call about. So all this aspect has been taken care. Now, when new nurse joins the hospital, we have something called induction program. And this induction program, we explain them all the standard protocol procedures they need to follow when they go to the bedside, when they start, taking care of the patient. So initial period, when they are there in the hospital, when they newly joined, nearly a week, we don't give them a patient, but it's training which happens so that they are well versed with all our protocols and SOPs, which we need to follow later on. Thank you, sir. Hello?
Thank you. Thank you. Porter, you're muted.
Okay. Any other questions? Do you have any other questions you'd like to address to Madhuri?
Hi, Madhuri. It was a very, very, very interesting and a very nice session. I'm Havavi Fosdar. I'm the GM from Ambani Hospital, and I got the privilege to attend this program. So it was very, very good. Only one or two things more she has done it so intelligently. And more to add is that we have a lot of clinical alarm management systems in the hospital, which alerts us if a patient is in danger. So that is how we are on high alert. So there is a yellow alarm, there's a red alarm, there is an emergency alarm, there is a code blue alarm. So in addition to what she told, she has really brought the topic out so well. So I just wanted to add that for the providing the safety, now we have these alarms. Yeah, thank you so much.
Thank you, Havavi. And one more thing I want to add, I think based on this codes, what just Havavi has spoken about, codes, we have a different codes in the sense we have code blue, which is for the medical emergency. We have code red for the fire safety. Then we have code orange for, rapid response team, so that we can handle our patients at the earliest, so that, the condition doesn't worsen. Then we have a code gray, for the physical violence. So this certain codes are there, code pink for the, child abduction. So these codes are available, and staffs or, all employees of the hospitals have been trained, very frequently reviewed with them, so that anything such happens is been alerted, and this code's been activated and proper action has been taken. So it's very important that everybody should know about this codes, this emergency codes. Thank you.
Are there any more questions? If there are no more questions, then I'd like to propose a vote of thanks to Madhuri. Madhuri, thank you so much for taking time off your busy schedule. And on behalf of the Rotary Club of Bombay Midtown, I wish to thank you very, very much for the extremely, I would say, human approach and talk to us. You gave us a very deep insight of how a patient has to walk in, and the part where there's the most critical part where his details are taken, and then an evaluation is done, and the part to the OT and things like that. Just to echo Bernard's sentiment, more of a sort of observation. Your staff, I have had the opportunity of dealing with your staff as a relative, are extremely good, cordial. They explain very, very well. But the total ambience, I think, I'm sure you must be doing something about it, but how to make it a little more cheerful? I don't know whether it's plants or colors or, things like that, or some light music. I don't know. I'm just sort of how to make the patient comfortable in the surrounding where you see, as you enter, you see people running around, a smell of medicines. This is absolutely correct. The first impression or the first experience a patient has entering a hospital is of fright. Okay, everything is sort of sanitized and all that. So how to sort of have a sort of, it's easier done in a clinic than in a hospital, but in a sort of way in the attendance room, make things a little easy for him. That look, it's a hospital, but don't worry, you'll be taken care of. And your frontline people have to be that little extra saying, look, don't worry, these things are normal, we'll take care of it, and try and divert him. As you say, the mind is more important than the physical injury he has had or suffering or sort of he's being admitted for. To give him an ease of mind, so he knows he's coming to a happy place and he's going to get a happy treatment.
Right.
Thank you very much. It's extremely nice of you to have addressed us. And on behalf of the Rotary Club of Bombay Midtown, thanks once again for spending time with us.
Thank you, sir. Thank you so much. Actually, there is a lot to talk about, but I could gather a few points.
No. We'll have another session again. You can be sure.
Okay. Okay. That's not a problem. Sure. I think there are many other things also, many things rather. Wonderful. So anyway, yeah. Thank you so much, sir. Thank you, Rotary.
Thank you.